Hello, Namaste everyone. I welcome you all to this Gurubodha session 10 with my Ayurveda teacher Dr. M.B. Gururaja sir. On behalf of all the participants and the future podcast and YouTube viewers, I welcome Dr. M.B. Gururaja sir to this Gurubodha session 10. Namaste sir.
Thank you, Janardhan. Namaste to everyone.
I am the convener, Dr. Janardhan Hebbar, founder of the easyayurveda.com. So this is our 10th session. Dr. M.B. Gururaja sir is an Ayurveda practitioner with more than 20 years of experience. And he is also a professor in an Ayurveda college. And he's the owner of Dhawla Pentacare Ayurveda Treatment Center, where he sees his clients and also conducts panchakarma and etc. therapies. First is the relationship between the diabetes and the liver disorders. So there was an article in Liberate stating that if you have diabetes, it may be a good idea to get your liver condition examined. This is because studies show people suffering with type 2 diabetes with a higher body mass index, meaning type 2 diabetes people with obesity are highly likely to have liver fibrosis, a condition that can lead to cirrhosis of the liver and later liver failure. So in the last class also, Gururaja sir touched regarding the fatty liver condition and how grade 1 is not really that much important clinically and whatnot. So Dr. Anup Mishra, chairman of Fortis CDoc, a hospital, said they recently conducted liver ultrasonography and fibroscan tests to assess fatty liver and fibrosis in 250 diabetic people. And they found that 85% of the patients had grade 3 hepatic steatosis, meaning fat cells comprised more than 66% of their liver's overall weight. So it appears to be a growing menace. So my question to Dr. Gururaja sir is that how to decipher this in the clinics. It's very common in India and also in all countries that having diabetic cases has become very common, especially diabetes with obesity. They almost go hand in hand, and now we also are asked to take care of the liver profile. So how to go about this procedure, sir?
So definitely, if you observe what the acharyas have said very clearly, Prameha itself is a disease which is kept under Astamahagada by most of the acharyas. If you observe the dosha, dusha and all those things, it involves the multi-system. The dusha in Prameha, according to Ayurveda, it contains even rasa, rakta, mamsa, meda, majja, vasa, lasika, everything it covers. So when such a disease which is covering entire shrotasas and different type of tissues, definitely it has its own effect. But regarding this new area, they have identified that there is some correlation between diabetic patient and the liver disorders. That may be, but it is whether it is due to the diabetes itself, that may be a chance, or whether the study has been conducted in such a patients, those who are diabetic since last 5 years. So they're already taking certain one or the other oral hypoglycemic agents, a chemical drug. Even that drug may be causing problem to the liver. So that may not be ruled out. So we need to understand all those aspects. But in Ayurveda, very clearly it is said, Prameha or the diabetes, it is a type of disease more in favor of Santarpanotta. So which is over nutritious, or maybe because of we are pushing the system into such a way that it has to handle with a lot of energies. When we are unable to maintain that, definitely the things will go in a wrong way. If you observe the pathology or samprapti of Prameha, very clearly there is a mismatch with the Agni as well as inside the nutritional material. So in such a manner, definitely we know that everything, whatever we consume, it has to be metabolized and it has to be made homogeneous with the body at the level of liver. So when liver takes an important role, and this is an endocrine linked disorder, the multi-system involvement and multi-tissues involved, definitely there will be a lot of stress on the various tissues. All these things ultimately put a back pressure on liver, and liver ultimately ends up with some wrong deeds. That's the reason, because there is a lot change in our food style, there is a lot of changes in our lifestyle, There is a lot of changes in cases of our physical activity. So all these are progressive in such a manner that most of the people living in urban areas, they are turning to become the type 2 diabetic patients because of various reasons. So it's a multifactorial. So in such a scenario, definitely when system is being added or dumped with lot of energy, it has to be metabolized by the liver, and liver is at stake. So automatically liver takes the wrath. So because of that, the liver ends up in trouble. So that may be a coincidental identification, they are understood. But here once again, along with the disease nature as well as maybe the management part of it, what the chemical drugs or synthetic drugs they are taking, that too also may be contributing certain factors to develop the fibrosis in liver. So we need to understand these part also.
Ayurvedic Samprapti of Pramehas, Master Madhava has clearly said, Medascha Mansascha Sharirajam Cha Kledam Kafo Bastigata Pradushya. It is explained. Diabetes, obesity, and even the fatty liver disorders, all are related with the number one dhatu that is explained in the shloka itself, the Vedas, Medo dhatu. Under which circumstances you would, suppose a patient with diabetes with, higher BMI comes, under which circumstances you would go for examining the liver or ordering a liver function test, sir?
See, examining the liver function test is not a mandatory one when a patient comes with a type 2 diabetes and is obese. So in that situation, most of the times what we go for is a lipid profile examination, supporting thing. Then many a times we have come across those who are obese may not be having a bad lipid profile. Whereas a lean person coming with a very bad lipid profile and the bad cholesterol is very high. So that doesn't make any sense of understanding the things. But obesity in the total body bulk of fat, if it is more, then definitely it is nothing but what he has consumed through the mouth. So it has the energy of reach it to the body through mouth only. So in order to overcome that, we need to understand that something to be done for the related with the intake. That's what the Ayurveda and Nidhana very clearly says. Asya Sukham. That is the first line. What he says is Asya Sukham. The whatever the way we like to eat and whatever the quantity we like to eat, we consume it. So ultimately it has ended, and it is not a sudden one day happened thing. It is a continuously happening process, and we ignored it in the beginning. So ultimately the person lands up in a big disease. So we need to understand that.
It is very important to know that sometimes a lean person can also have a fatty liver disorder. I mean, suppose if we have diabetic person with obesity and liver complications, or diabetes with liver complications, how to plan a treatment there? Can there be common herbs or medicines and panchakarma that we can choose which target the diabetes and the liver conditions as well?
Definitely. First of all, if it is a diabetic, many times may not be a suitable candidate for panchakarma type of thing. But provided if we analyze the patient and his body mass index is supportive, and there is, if you consider this condition as bahudoshaja, then we can go for the virechana type of things, which virechana which supports the liver functions, as well as it also helps to revive the liver conditions, and even also it helps to remove the toxic materials from the gut. So it entirely supports all the three doshas, and definitely with the predominancy with the pitta. So when Agni is maintained with these type of activities, definitely it is going to help the obesity as well as diabetic condition plus liver disorders. And we have a lot of common drugs like Katuki and Haridra and even Nishamalaki, all these type of things. There's not only Guduchi, they not only support the diabetic component or the part, it also supports or clarifies or rectifies even the liver functions. So definitely even Kalamega, Kiratikta, these are all the drugs which have much importance. So it not only clears the liver functions, it also helps in overcoming the sugar values. So definitely these are some of the drugs which can be taken care or utilized in both the conditions of obesity as well as any liver disorders associated with diabetes.
In a known case of fatty liver changes, maybe of grade 3 or more, How long Ayurveda treatment usually is required so that liver starts functioning normally and gets rid of the fatty deposits, sir?
Usually, if a grade 3 fatty liver or something like that, which is once again beyond the first stage, which requires a treatment protocol, it depends. If you suggest the patient to go for the Virechana and do the procedures, then the results may be within 1 month. So if it is right away only Shamana Chikitsa because the patient body mass index is not supporting or some other factors you are feeling that is Ayogya or person not fit for the Virechana, then you can go for the Shamana Chikitsa, that is a palliative treatment. So in the palliative treatment, if continuously it is done, then it may take up to 60 days to 90 days to rectify.
If you are to go for Virechana out of the Ruksha Virechana, Snigdha Virechana, probably the Ruksha Virechana makes sense because the Snigdhata is already increased due to the Medha Dhatu there.
No, there is no hard and fast rule, but it is a Santarpana Vyadhi, Santarpana of the Vyadhi, that is because of the extra nutrition. But we need to take concern in such a way that sometimes a patient may be even Sukumara, even though he is obese and all those things. We cannot go with a harsh way of purgation. We cannot go for the Tikshna Virechana. So we can go for the regular type of simple Haritaki Churna with water, something like that. If it is a non-diabetic, then with Guda. So such combinations can be made. Only with Jayapala and such type of drugs can be taken based on the requirement. If too much of obesity is there and patient can withstand and the Manobhala is also good, then we can go for the Tivra Virechikas or Tikshna Virechikas like Jayapala and such drugs.
Moving on to the next topic. So this is a case treated by Dr. M.B. Gururaja sir in the Davda Pentacare Ayurveda Treatment Center. Can you please walk us through the case? How did you approach details, please, sir?
This is a young lady. She has come to me with already diagnosed case. She has been put on steroids since a long time. It is a case of chronic idiopathic thrombocytopenic purpura, which can be taken in Ayurvedic perspective as a Tiryak Raktapitta. So when I suggested her to taper the steroids, then slowly she develops these type of petechial hemorrhages spots all over the body. So with the tapering of those steroid drugs, I started with Ayurveda drugs like Chandrakala Rasa and Estimadu Ganavati and a combination called Karika PT, so which contains Panchatikta as well as Karika Papaya. So slowly with these type of drugs, the patient condition develop into a normalcy. The petechial hemorrhages are gone. But unfortunately, I'm still, she's under treatment. I'm unable to get the result with the low platelet count. She is having a very low platelet count. This is not rectified yet, and she's in a continuous treatment. But her petechial hemorrhages has resolved totally. So that is a one plus point with the use of Chandrakala Rasa and Estimadu Ganavati and Karika PT. So such combination of drugs, which is going against the Pitta as well as the Rakta, peculiar Tikta Rasa Dravya as well as Shita Virya Dravyas. So definitely it has resulted in that way, and this is the outcome. But she is having a very low platelet count, somewhere around 12,000 like that. So such a low level, but she is somehow managing with that.
In the set of herbs that you use, Yastimadu, yeah, classical Pittahara, so Rakta Pitta, we can make a correlation. So also is Karika Papaya very frequently used even in case of dengue treatment where platelet counts are low, we need to pick it up. Like what's the logic of using Chandrakala Rasas? Like out of all, how did you pick the Chandrakala Rasa?
Chandrakala Rasa in Falashruti, it is very clearly mentioned it is for the bleeding. Wherever there is a bleeding spots or bleeding, it's there. Chandrakala Rasa is used. So it's nothing but Raktapitta. So it's a drug of choice in one of the drug of choice in Raktapitta. So I selected that Chandrakala Rasa.
And after how many days of treatment did you arrive at this stage where
in between, I think it is a gap of 1 month. These two photographs, gap of 1 month or 45 days, something like that.
And any other treatment plans that you are considering to revise the platelet counts?
Because it's a very sensitive case, and even she's a female, and a lot of concern, and she's feeling so many times, and something like that, even suicidal tendencies. So I cannot simply go with a lot of medication. I need a lot of counseling, and I just usually go for a counseling, and I select only these type of drugs. In future, if it is any plan, if I can go for using Shatavari, Kushmand, or Gokshura, this type of drugs to help the Pitta Shamana. So let me see that in future what happens.
Thank you very much for deciphering the case for us, sir. And going to the next topic, pandemic brings Indian consumers closer to Ayurveda. According to experts, this Ayurveda demand has risen, and now Ayurveda is going to become $15 billion industry by 2023. It's not a very big number. Still, some kind of encouragement we can pat on our backs. $15 billion. So there has been a surge in demand for Ayurveda products after COVID-19 pandemic, as people have realized the importance of traditional immunity boosters. According to experts, this demand for Ayurvedic products, along with growing the discretionary spending, can help in Ayurveda becoming $15 billion and go beyond that. An Apple iPhone sells probably, I don't know exact number, honestly, but it probably sells more than $15 billion of worth of iPhones they sell in a weeks or months. But still, we are in a nascent global domination with Ayurveda. So, how do you feel about it, sir?
So just a mere number. We have two important segments here. That is organized sector and unorganized sector. We can get the information and data and even the statistics from the organized sector, but we don't know the exact the data of unorganized sector. How much herbs are being used and how much it is money relation has taken place, because many times we Vaidyas, they themselves collect the drugs from the nature and they prepare medicine, they sell it to their clients. Such type of things are unorganized sector is a lot. The huge scope is there, but still, when compared to the Chinese traditional medicine, our global market is very comparatively very less. And if it is increasing after the pandemic, it's a good use. At least people now realize that Ayurveda can deliver a lot of important things to their life, and it has a meaning in their life. That is a good progress. Definitely we will have a good future for Ayurveda and even the Ayurvedic market. Definitely people, once they expose themselves to these type of products and results outcomes, definitely they will try to search the effect and efficacy of Ayurveda in other diseases also, not only for immunity boosting, then for the other diseases also. Definitely that the scope has been definitely widens after these developments which is taking place after the pandemic. And in perspective of Ayurveda thing, it is a good thing what's happening. At least at somewhere around down the line, the people has to understand this, the efficacy of Ayurveda and its role, how it has been used 3000 5000 years ago, and how it is been still it is in practice with all onslaught of technology and modern medicine, and still it is surviving. So itself is suggests that it is how capable of handling the things. Definitely in the chronic diseases and other managements, Ayurveda has a supremacy when compared to the other drugs, other system of medicines.
And I also feel that it is now for the honest Ayurveda, purely Ayurveda practicing Ayurveda doctors in India and also in practitioners abroad, they have to like up the ante, up their game. They have to do more and more like public talks, home remedies or herb uses awareness program. I'm sure many of the participants that are here, they conduct such talks and all. So probably they have to, like, I mean, we have to, market ourselves in a better way with more and more talks in, communities and whatnot, sir.
See, we have a different set of people, or we can say it's we have a different set of audience. Not everyone will be friendly or savvy with the technology. So some may be searching the things in YouTube, and some may be searching in Google, but some may be looking at some books, some may be looking at some audio talks or something like that, or something like that. So there will be a different set of people with a different set of interest. So definitely somebody is doing some awareness camp, somebody is doing some awareness camp again about the plants and the cultivation of plants, somebody with the utilization of the plants, and somebody with the principles of Ayurveda, and someone is propagation. See, propagation, let it come from any direction. It may be CME, it may be short talk, or it may be some videos, clippings, or some presentations, or maybe peer-reviewed journal presents, statistics. Let everything speak about Ayurveda. Then automatically it will be growing in multi-direction. One naturally surviving thing has to grow in multi-direction. So that's a good sign. If somebody is doing some awareness program, there may be, but we need to understand important area where we need to inculcate this habit is bring the concepts of Ayurveda into the minds of young brains. That is, very particularly those who are in high schools and colleges. If you inculcate these ideas and the concepts of Ayurveda into their brain, they will become future prospective doctors of Ayurveda, or they become future prospective clients of Ayurveda, and they may practice these things in their home, and they develop next generation, they will pass down this information. So that is the where the very important thing we need to do it. And of course, nowadays the young generation is very much tech savvy, and they can understand and handle these informations from the Google and all these search engines. Definitely, it will be good if you put a lot of efforts on those areas to provide them the necessary documents and the informations regarding this. And propagation, if it is done with all these things, along with that, if you start giving the results in patient, that is very important. Just simply just talk doesn't make any sense. If you talk and also deliver, then it comes the very wonderful thing.
Like you told, for the my websites like Easy Ayurveda and ayurmedinfo.com and all, when I look into the analytics part, more than 30% of the people coming to the website searching for Ayurveda remedies, herbs and whatnot. So more than 30% of them fall between the age group of 15 to 30. So it's a very good sign that the young people in their second and third decades are looking up to Ayurveda and all. And probably it will be a good idea to at least have like 5 hours of their curriculum, maybe in the high school or at least in the science 11th or 12th, somewhere in between, because yoga is getting incorporated. So similarly, if a few basic concepts of Ayurveda and a little bit of herbs can give kind of a needed academic push to Ayurveda in a very early age to the students.
Definitely, that's the right area, right? The place where we need to give a little bit of push. So once even government is also planning for such activities, and Department of Ayush and Ministry of Ayush is also working on that lines. Definitely, if curriculum and even the subject a little bit importance on Ayurveda, Indian culture and history and these things, if rectification is done, definitely it gives a push to Ayurveda and even to the next future generation. They will be very choosy in selecting these subjects as well as the information. So definitely it is going to help.
With more and more knowledge of Ayurveda spreading, the myths like anybody can take any remedy or myths. I mean, if I read a few Ayurveda things here and there, I myself can self-medicate or treat other people. So probably with good knowledge spreading through the academic routes and all the Ayurveda community as a whole stepping up will be helpful in busting these myths and keeping away an attempt to paint Ayurveda as some kind of a just home remedy science.
See, regarding developing of myth and all those things, it's quite common, obvious. We can have myth for anything. Any science can be said as a myth. One who believes in the science, he accepts it as a truth. The one who doesn't believe or he is feeling some doubtfulness, he always go for that. And some non-believer will always be putting blame on the others. So such type of things are very common. See, we have some broad-based understanding or some beliefs among the population that Ayurveda doesn't have any side effects. Is it true? It is not true. If a drug is given in a wrong direction, a wrong dosage and a wrong person, then it can cause a side effect. But the strongest belief is that Ayurveda is herbal, it is free of side effects. So like that, the myths and understandings are different, even regarding the computers and how it functions and even all these things, there are myths all over the world. Wherever there is a science, there will be myth, and that cannot be, and that can be only by propagating the real science and things, slowly we can overcome it. But still, as the days advances and the time advances, new things will come, and a new myth will, a old one will go and a new one may generate. So this is a very superstitious things that let it be. Whatever the way, let it spread first. Once it spreads the people, then people will definitely think which is right, which is not right, and they will choose it and they will take decisions. So that's the reason we should just give in whatever the way we can propagate the Ayurveda, in maybe in the form of booklets, maybe in the form of pushing through the curriculum, maybe pushing it through the young brains, or going to some high schools and developing some gardens of medicinal plants, and even going to village, making some health camps. So many things. There are many ways of spreading Ayurvedic information. Let it be. In all these things, in every direction it spreads. Let it go in a very good one. Like just like how it is said, Ano Bhadrenta Krutavo Ishvatah. Let the virgin good things come from all the direction. Like that, let it spread in all the direction.
Talking about myths, last 2 years have been like totally myths and science coalesced. Like there is COVID-19, there are facts and there are myths. Then there was this vaccine and the treatments, new and new drugs every day, every week. Try to treat the COVID-19, and there is even in the technology world there is like 5G and radiation related to 5D technology and all. So then it was like individual myths layer. Now we have like cocktail of myths, like COVID-19 with 5G. It's causing this that. Rightly quoted the Vedas chant that let the science progress, let the truth spread, let's be receptive to all the truths and the science. Then naturally these myths will be taken care of. And another interesting thing that is happening with the promotion of Ayurveda is that many of the farmers. So what has happened is that in places like Bangalore, these techies and software engineers who are there in Bangalore, Noida, Gurgaon, all those places, because of the pandemic around, they have gone back, and now I see a lot of queries of these people taking up farming, and now they want to not only do farming but also do organic farming. So with organic farming, they want to do cultivate Ayurveda herbs. So and there is this new avenues opening up and new opportunities coming up in terms of organic farming and many other places.
Yeah, definitely, because in the during the pandemic, if you observe, the rates of ashwagandha, guduchi, estimadu, shatavari, they all jumped like anything. Even gugulu almost doubled or tripled the prices. So this is a very common thing, because when suddenly the market demand is up and supplier is not there, and you cannot have it is not a chemical thing which is factory made, it has to grow naturally. Definitely there will be demand, and whoever has the thing, they have taken the care of these demands, definitely fetch it the higher prices, and this push in the market in such a way that, because many people they lost their livelihood during the pandemic, there is a lockdown and all these things, and they wanted to shift back to some other alternative of earning the resources, and definitely they found this is a new area where a very large scope is there, and they understood that with the pandemic, how the health is important, and those which are associated or attached with the health sector definitely thrives for the longer time. So that's the reason they want to attach it with these things, and Ayurveda has definitely has taken a boost with the pandemic and these type of occasions. Definitely the market is full of opportunities for the growth of organic farming, as well as the herbal material sampling and their nurseries and the whatnot else. The people are doing farming with tulsi. Lot of people are doing with that nowadays, and it's a good thing, because when they start doing these techies and these people, they have a background idea of marketing and how better marketing can be done, and they'll find out the supplier and as well as the buyer and everything. They'll go for the contract farming, and there'll be no loss, because this is a very important area. Anybody can grow, but who is buyer? If you don't know the buyer, then the product will perish. So that should not happen. So that's these things can be very well managed by these techies, and if they are entering in, that's a good sign. Let them enter and enjoy.
Yep. From the world of computers and wires and Wi-Fi to the natural earthy earthy mud, smell of mud, water, and greens. Welcome. Going back to the few other questions that have come, Gnana Karthik asks, if the liver has mild coarsened parenchyma after our treatment, can we get normal liver parenchyma back? LFT is normal. Do you have any experience on normal liver scan after our treatments?
Definitely, the change in the parenchyma usually occurs in chronic liver disease, and which ultimately, when the coarse parenchyma occurs there, and ultimately turns into cirrhotic liver. So with our treatment regularly, we can stop the process of changing this parenchyma. Of course, we have done a lot of progress in this treatment, but to show you as a evidence, I don't have a comparative fibroscan showing that the earlier prior fibrosis was this much and now after treatment is this much. But I have a list of patients those who are suffered from cirrhosis and a pre-cirrhotic condition and a cirrhotic condition. They cleared up their problems and they are now living a happily the normal life. Even some of them have even left the treatment because they have already taken treatment for a period of 1 year like that. So I only suggested them to stop the treatment, and they're without any medication, they are leading the normal life, and there is very much normal LFT and everything. But I don't have that comparative fibroscan studies to show it. In future, I'll definitely go for it.
But it is quite common to see that the liver function test corrections that should be like quite common in a practice, that LFT was wrong, and that
liver function test as well as the serum prothrombin time and all other areas, that everything will become normal with the treatment. That is very much reversible. Even the serum albumin and serum globulin ratios will be, usually in case of cirrhotic liver, globulin ratio will be higher than the albumin. After our treatment, it becomes reversal because it's a normalcy, that will be serum albumin will be higher than the serum globulin. So even that ratio is also achieved with the treatment of Ayurveda. So that all those areas are taken care of. But to compare this fibroscan, I didn't have a facility and I didn't have that scope to study in that. Of course, in future I may try this one and then I'll put it, because anyhow the lot of cases of cirrhosis you do come to me, so I'll go for it next in future.
And also when you know that the client is clinically improving and the LFT and other blood tests are improving, so we know that liver is improving, it becomes a little hard to push for again scan because we know that liver is already in a normal course.
No, usually when rather than giving a treatment, simple treatment, I go for a counseling. Lot of things I'll suggest to them, what are the rectification has been done, what is the state they are presenting with, and what may be the future prognosis, and how bad the state you are, and everything I'll explain to them, and they'll listen to me very clearly. And if they listen to me, then only I'll start treatment. So I'll make somewhat unwritten commitment from them that they will continue the treatment and they will do all the laboratory investigations or whatever it is which I suggested from time to time. And definitely, usually they will, because once the things are rectifying and people are feeling good, definitely they will follow the instructions, and there will be no hand wring that they will not go for any, even they will be happy to see that there is things are rectifying in the laboratory document.
Yeah, I mean, when there is benefits to see, the clients will obey whatever we. Next is Dr. Vivek asks, good evening, sir. In what dose will Chandrakala help in menorrhagia, and can it be given in menopausal syndrome? Menorrhagia has become like very common, especially with women in the 40s and 45s. Nearing to menopause, they'll be having DUB continuously, or the periods get shortened, and it keeps on increasing. So Chandrakala alone or in a combination, how to go about it, sir?
See, menorrhagia, metrorrhagia, and this type of dysfunctional uterine bleeding and menopausal bleeding and all these things, I do get the cases, but the result, let me put it very straightforward, the result is out of 2 cases, it will be 1, I can get the result. In another case, usually means somewhere around 50% of the cases, we get 100% rectification, 100% correction, and we find the good result. but remaining things, many a times, we need to take up the help of other system of medicines to clear the conditions. I do come across with these things, and I usually go for Chandrakala Rasa as well as even Pradharantaka Loha and as well as Bolabadha Rasa and even Stiplon tablet from Himalaya. I use all these things in a combinations. Along with that, Estimadhu Ganavati, even Shatavari, Gokshura, these type of things. After these combinations, in 50% of the cases, I get 100% result, but remaining 50% it is marginal benefit or moderate benefit or no benefit. So that is the criteria. Many times we will be pushed to accept that some other system of medicine is required to control the bleeding.
When we are giving these styptic medicines in a higher dose, say Pradharantaka, Loha, Bolabhadra, Stiplon, etc., do we need to consider the clotting factor of the blood? So that should be kept in mind, or
if a clotting factor is to be kept in mind, then bleeding would not have been taken place. If a patient is suffering with a heavy bleeding, means the clotting is nowhere concerned. So we need to go for an increase in the clotting type. So we don't mind in using our drugs in a very good dosage, because see, you observe that I go for up to 4 tablets of Pradharantaka Rasa, 4 tablets of Bolabhadra Rasa in a single patient per day to control the bleeding. So it doesn't make any, it is not a bad idea or it is not a wrong way to handle these type of things with such type of doses. And of course, whatever the doses we give, that will be only for a shorter duration, maybe 3 days, 5 days, 7 days, like that. Within that time, we need to get the results. Otherwise, it will be difficult, because we cannot allow the blood loss. That is a very important one of the place where the, according to Ayurveda, Jiva is residing, one of the pranayatana. So we cannot leave it to happen, it's a go like that. So we need to go for that clotting and withhold the bleeding. So we need to use such a type of 2 to 4 tablets per day of each type of category. I have used it and I could get a result in 50% of the cases.
whenever I get a client like 40 years and above with menorrhagia or irregular periods with, I mean, when the periods happen, usually it will be with heavy bleeding and whatnot. I mean, during the menstruation phase, these things are given, but even during the non-menstruation phase, as a continuous medicine, I would put say a low dose of Himalaya Stiplon or Ashoka capsule, or even a low dose of Bolabhadra Rasa continuously for a few months, so that at least the successive menstruation cycles will be with less bleeding.
Yeah, definitely. We need to balance the doshic imbalance inside, as well as the hormonal disturbance has to be taken care of. For that, what a regular treatment has to be given, that we need to give it. But at the time of bleeding, the phase of bleeding it's there, then we need to go with the higher doses. So usually when there is a bleeding starts, we will watch it for 1 to 2 days. If it is not slowing down the number of pads what they are using, if it is increasing and patient is feeling that there are a lot of clots, then definitely we will go with a higher dose of it for a short duration of 3 to 7 days. So within that period, it has to suppress. If it is not suppressed, then we will be forced to go for the other system of medicines.
Thank you, sir. Pradeepa Rayasamji has asked a question. Namaste, Dr. Gururaja sir. Here is a case of female 50 years old going through depression and uterine fibroids and menorrhagia. She undergoes hot flashes, sweaty peripheries during her sleep. How to approach this case with the perimenopausal phase menorrhagia? Ashokarista Aragavardhini, Varanadi, Kalyana Kavleham, Stiplon, Shirasva, Shatavari, etc. Chandrakala adding would be helpful. Your thoughts, sir?
Definitely, Chandrakala Rasa and even Pradharantaka Rasa would be helpful. Definitely, if there is a continuous bleeding, because many times these patients do have a bleeding phase of almost, they'll say that every day they'll be using 2-3 pads, and the bleeding is from since 28 days, 34 days, 40 days, like that, there'll be continuous bleeding. And it is not only making the female to lose her health, as well as it also gives a lot of stress to the mind. It have a lot of irritation to the mind because of this regular things happening in her. So in order to overcome that, we need to go for Pradhantaka Rasa as well as Pradhantaka Loha, it is same. Or even Chandrakala Rasa or Volabadha Rasa accordingly with a higher doses. And even many times I will go with the Estimadu in the form of Kshirapaka and something like that. We need to address the Pitta as well as clotting factors. So Gokshura, Kushmanda, Shatavari, these are the drug of choice for us.
When the menorrhagia is running for many months, it's also probably good idea to have loha dhatu or iron supplements supplementing so that the rakta dhatu is also taken care of.
Definitely, that's the reason. That's why we have got that Pradhantaka Loha and all these things. The Loha component is also there in that. That will going to help us in. Of course, there are many proprietary combinations are also available in the market, which can be used. Like Emptitone is there, Emptitone Fort is there, Gynecolin is there. There are plenty of preparations in the market. Like Gycon is there. There are a lot of preparations which can be used accordingly. Even one preparation I usually go for it, that is gynecolin. I will ask the patient to take it 10 ml 6 to 8 times a day. So that type of thing continuously, if it is given, then slowly within a short span of 1 to 2 days, the bleeding will be reduced.
Gynecolin syrup, sir?
Yeah, gynecolin syrup.
Which company manufactures? I mean, basic info, sir. Kerala Ayurveda, I think. Yeah, Kerala Ayurveda. Miss Vinaya Saunders comments that you mentioned other medical systems, but in English medication they use only the birth control pills. That causes a lot more issues than it solves.
The reason is the first and primary aim of any doctor in such a situation is to avoid bleeding. We cannot allow the blood to lose. If a person is losing the blood, how can we allow it to for a longer duration? Because otherwise, then patient hemoglobin will go down in such a way that we need to go for a blood transfusion. For whatever the other system of medicine that is, they are using the hormones. That hormone combination pills what we use, it's only for a time being a short cycle for maybe 1 month or 2 months. So with that, at least that will be rectified because we have already tried our all medications in that. When the patient is not able to get the result, then we will be not having any other idea or any other scope rather than accepting the truth that we may have to go for certain hormonal pills to control the bleeding.
Pradeepa Rayasimji had raised her hand. Can you please go ahead with the question, ma'am?
So going back to the previous case of the perimenopausal with menorrhagia and uteroid fibroids, right? So I have when you mentioned Shatavari and Kushmandavaleha. So now in a case where there is uterine fibroids and this patient has extreme bleeding. See me for like 40 minutes and she left. She was bleeding throughout and she had to go change multiple times. So isn't Shatavari, or I think I'm confused, like, this is just one specific example. But when a case like this comes, should we focus on which one should we focus on? Should we focus on like balancing the Rakta Dhatu first and giving Loha type of medications to increase the, reduce the anemia? And also, should we also focus on controlling the bleeding first, or a holistic approach to do a balance of both? We know, like, where am I going to get wrong?
No, first of all, in these patients, we need to understand their basic nature. If they are obese and if they are having a lot of issues with, a hormonal imbalance, and of course there will be fibroids. When there is a fibroids, that the endometrial surface will increase. Definitely in those patients, definitely there will be periodical bleeding will be comparatively much higher. So when such thing is there, first our priority is to stop the bleeding because loss should be prevented. Once loss is prevented, then we can go for the replenishment or the replacement of which is something which is lost. So we need to select such a drugs which are both looking at improving the hemoglobin factors as well as improving the Rakta Dhatu, and as well as it is also controlling the Pitta. So we need to select such type of Shitavirya Dravyas along with some Loha preparations like Pradhantaka Loha Along with that, some Shatavari here or some even Gokshura, such type of, Ashoka, Lodhra, such type of drugs, if it is selected, definitely it is going to help us.
It will be like Shita Virya Pradhana, Shita Madhura Rasa Pradhana Dravyas.
Yes, Shita, Madhura, Tikta, Kashaya, that is the predominant area. The drug should be of those nature.
Too much Apanavayu Dushti in these cases, Shirodhara or Nasya helps. I mean, rather than like Shirodhara and Nasya, which entirely targets like head and neck region, probably this Shatadotagruta local application, because in Master Sushruta explains for fifth month pregnancy bleeding, in case of threatened abortion, he explains that Shatadotagruta local application in the in and around navel region application is somewhat helpful in checking the bleeding. Though it's not like a kind of a direct treatment, it can be of little help, sir.
Definitely, we can go for this as a type of information. We have to take it for the study purposes as well as to understand it statistically. Until unless we regularly use this in particular conditions and get the results, we cannot claim it. Moreover, nowadays, when a patient pregnancy has become such a precious thing, we can't even afford something which is going as an abortion or threatened abortion and trying with all these of things which may helpful or may not helpful. So usually, patient will go with the flow of how the society is behaving. Definitely, in these cases, they will try to get the thing which can be as an emergency management. What should be done? That is the ideal one to do it. If it is a secondary, if you are very mild cases and where patient is convinced and we can take the chance, then we can go for such type of patients to registered into the or enrolled into the studies that can be given with the consent and all those things. Then we can use those techniques and information of our text to prove their efficacy.
Namaste, Dr. Gururaj and Dr. Hebat. My question is regarding the girls who have extreme pain. The pain is so acute that they faint, they fall down, and they cannot move or do anything for days at stretch. Like these are extreme conditions.
So
Birth control
usually,
pills also do not work. Painkillers do not work. Like nothing has been working, and there's absolutely no problem with their body, according to all the modern testing that has been done on these girls.
so you start doing this one. I do get these patients, and this where I have got the results is using Sukumara Grita with Hingvastika Churna. Regularly, Sukumara Grita with Hingvastika Churna. I usually start this from the 21st day of the cycle till the 31st day or even like that. So by that time, the bleeding phase will come and go. So if a 10 days earlier time the person has started taking Sukumara Krita with Hingvastika Churna 2 to 3 times a day, then definitely the things will settle down in 1 to 3 months time. All your menstrual related pain will go off.
So you said 21 days, but these people have very irregular periods. So how are we going to recommend when do they start?
Okay, if that is the case, then you start from one fine day, the 21st day, thinking that we can't have an exact number of day. Then you start from one day. Slowly with this combination, things will settle down. This will be a problem until the first cycle. So once there is a cycle, then afterwards there is no problem. You can select the 21st day.
And the Sukumar Grita, does it has to be mixed up with how do we give it to them?
One spoon, that is somewhere around 5 ml to 10 ml of Sukumara Grita mixed with 1 spoon or maybe 3 to 5 grams of Hingvastika Churna, and should be taken before food.
Hingvastika Churna containing Tricotandol will it not cause increased bleeding?
No. When these things are there, these drugs are used in such a combination, they will control the Apana Vayu in such a way that, because Apana Vayu is the one which is responsible for the Garbha Nishramana Kriya and Shakrat and Artava Niskramana Kriya and all those things. So definitely Apana Vayu will be controlled, and that's why Urdhagata of the Apana Vayu will be reversed. So definitely the patient feels comfortable.
One of the things to your point, sir, The Hingvastakchuna's shloka says that it says Janayati Jataragnim and Vata Rogamscha Hanti. And with the Agni increasing and the Rasadhatu getting refined, Artava being a Updhatu of Rasadhatu, so the whole cycle starts getting better and better. Probably Agni and Rasadhatu correction in terms of use of Sukamara Gutam, Hingvastakchurna, that is one of the modes of action there.
Definitely, if Apana Vayu is moving in a normal direction, it will bring the other things of Artava, Srava and everything in a normal direction, normal quantity and direction. If it is become Urdhvagata, then definitely it leads to a lot of problems. We need to go for such type of drug combinations which will reduce the Apana Vayu or even rectify the Apana Vayu. So that's the combination which I have found very good results in my practice. Sukumara Grita in combination with Hingvastika Churna has given me wonderful results.
And Pradipaji chants in saying Gandharasta the Yeranda Taila Pichu in the navel region works miracles for painful periods followed by mild fermentation. Yeah, again a Vatahara action there. So.
Definitely, that can also be done. Of course, many a times patients with that type of problem, when they approach, they'll be frustrating with the periods and it is a menace. They'll request, sir, something to be done to stop this. So in those patients, they expect that something to be taken and very easily it should go off or some injection or something like that. So if you want to go for a pichu and all those things, and she has to get admitted and all these big issues are there. Not it will be possible for every patient. But consuming Sukumara Grita and Hingvastika Churna combined, it can be done even at a home and even at the clinic, even the IPD setup or OPD setup, wherever it is. So that is the most convenient combination, we can use it.
Yes, Vinayaji, please go ahead.
Sir, thank you for that new combination. But what I have used in my experience, so in my experience, I work with a lot of teenagers who are addicted to opioids and other drugs. So it starts off with birth control pills and other drugs they've been taking. Mentally, psychiatric drugs also make them get addicted to these drugs. And when they come out of all these pills, their uterus cannot stop bleeding, because there is so much of hormonal changes that has happened. So what I have experienced, which has helped me, is the decoction of lodra, daru haridra, vetiver, licorice and dhruva, because that works as rakta and then vasa powder with water also helps to stop that bleeding part. And nasya with dhruva ghee has also helped, and I also asked them to have goat milk. That can also help, but it usually takes at least 3 to 4 months for them to regulate their periods. They tend to bleed, but if you allow them to do that, the body actually takes charge. But if we use the medical intervention with different pills, it actually takes a step back. So that was my main concern when I work with all these girls, because they want to get rid of it, but then there is a psychological factor that our uterus holds on to certain emotions. So again, these girls have traded sexual intercourse for the drugs and all those things. Those are all held in our uterus, and when those emotions just discharge by itself, it takes 3 to 4 months for it to fix naturally. So the medical intervention is not even needed sometimes, but you just have to emotionally start working on what are the thoughts coming up and why they are in this position, first of all. And that has helped me. So I just wanted to share that. But thank you for Sukumara Gritam and Hingvashtaka Churna combination.
Is colloidal silver or colloidal gold used in Ayurveda? What conditions are used? There's a lot of confusion on the use of colloidal silver. Some people say that it can cause skin to turn blue permanently.
We don't go for colloidal silver or gold in that form. We use in Ayurveda, it's a nanoparticle and it is a very clear bhasma, we call it as. And once we say it is a standard bhasma, that bhasma is totally non-reversible to the metal. So it won't behave like metal. Whatever been listed in the Western medicine or anywhere in the science articles and all those things, these are the side effects of a particular type of metal. But what we are using is entirely a different set of thing. It is a nanoparticle of that metal, and nanoparticle of metal behaves entirely different than the elemental metal. So we don't need to worry about this colloidal gold and colloidal silver or something like that. We can use very authentic sources of basmas. From there you can collect it and use the basmas, are manufactured by yourself with an authentic manner.
Sir, I have one more question. I just wanted to ask, what about Falagi and Shatavari ghee? Will that help in that?
Definitely, but Falagrita has an influence on hormones. But here, where there is a lot of bleeding, our intention is to control the pitta first. So that's why we select Shukumara Grita. We can't take Falagrita or Shatavari Grita, but they are the second and third in the line. First choice would be Sukumara. Sukumara is more convenient, as it not only on pitta controlling, and it also going to help us without disturbing any of the hormones.
Shadanga Paniya, the soaked water with mushta and vetiver, sandalwood. What
in relation with what? Because the classical reference of Shadanga Paniya goes in a different manner in Jwara and Pipasa, Trishna, and these conditions.
will that not reduce pitta?
No, that is entirely different level, because on the whole body there are pitta, but presently the pitta is having a problem at somewhere down the body, wherever this particular pitta of Shadanga Paniya, what we are targeting, that is at the level of different level.
Okay.
So we cannot use Shadanga Paniya here in this condition, because the original shloka goes of Shadanga Paniya is something like different, that Musta Parpataka Uditya Ushira Chandana Nagarehi Shutam Shitam Jalam Dadyat Pipasa Jwara Shantaye. So that is the one which is for the Pipasa and Jwara and those combinations and conditions. This particular Shadanga Paniya is used. In general, using it is quenches or reduces the body temperature or reduces the pitta to some extent, and feeling of hotness will be reduced and your Agni will be rekindled. So for that purpose we can use it, but not for the where there is a bleeding and these conditions.
Okay. Thank you so much, sir.
Thank you for all the participants for your active questions. Thank you, Dr. Gururaja sir, for making this lively and answering so many questions.
Thank you for all the participants for actively participating and making the session something lively. And I'm always here to share the things, and also, of course, I'll also learn new things from the new youngcomers. Young brains will always have different ideas. So I always be open-minded and a rational thinker. And thank you all, one and all, for the participation.
Thank you. See you next Sunday. Namaste.